Welcome back to Sports Medicine on Tap. My name is Brandon O'Line. I'm sitting at Neck of the Woods Brewing Company with my good friend Dr. Frey. Dr. Frey, how you doing this evening?
Better than the Mets.
I'm sure.
Rough.
Look at us. We're doing back-to-back weeks of episodes. This is a fantastic sign.
Yeah.
Training camp's underway.
I know.
I start my training camp tomorrow, so this is like my last day of summer.
Yeah.
Although I feel like it's been over for a little bit there.
But this was a great summer for you, man. A lot of action at home.
Oh, yeah. So much. My first, it was our first summer as a family of four, and I feel like we crushed it.
Yeah.
We did Disney. I took my kids down to Disney for the NATA convention. Then we did a little trip to my dad's down in Maryland. So like we did a little bit of everything. We did a couple beach days, some pool days.
Yeah.
And my oldest son is like a fish now. He loves to swim, and obviously he's almost about to be 3, but he used to swimmies all summer, but he was just going for it.
In the water.
Oh yeah.
Yeah.
Lived in it. It was fantastic.
Yeah. And the fact that you're at NATA reminded me, like I'd forgotten, but like you engaged a few podcasters down there, and we were talking about maybe we'll circle back. It would be nice at some point to do the cross promotion thing.
A little crossover there. Definitely something that it'll be happening in the future, and I think also getting our setup at a convention would be fun. I think that's on our bucket list, if you will.
Just a fun thing to do, right?
Yeah, absolutely. So before we go ahead and dive into tonight's topic, I just want to give a quick shout out to our sponsors, Virtual Orthopedics and Spine. They have you covered from runner's knee to dog walker's hip to yard work back and laptop wrist. Guess what? They have a doc for that. So find the right specialist for you at virtua.org/ortho.
Cheers.
Cheers to that, right?
Right.
Yeah.
Exactly.
Let's give it.
We
We never really do a real cheers on air, so I changed it up. I went with the El Lote P, the Mexican lager tonight.
Right.
I'm a big sour guy usually here, but
yeah, I stuck with my sours. I love it, And Neck of the Woods Brewery, it's where we are week in, week out, and the sours are amazing. Across the board, the beers are amazing.
Yeah.
It's nice to be back.
But I think it's just the sours are underrated. For people who just listen, they're like, sour beers, that's gross.
Taste them.
It's a different breed or brand of sour beers here at Neck of the Woods.
Right.
And even with the change in management and ownership, they still haven't changed. They're still so good.
Right, I agree. And I don't know if it's like my Polish background or whatnot, but I've always kind of loved that sour flavor, sauerkraut. I love pickles and this, so it was right in line. It's just, it's just so good.
Oh yeah, without a doubt. So as we mentioned, but last week we did a very early primer for preseason camp and fantasy football discussion. And we're going to kind of stay on that topic of NFL preseason, but we're going to take a little bit to the home base, and what the hottest topic right now in the tri-state area for us Philly folks is Landon Dickerson and his knee injury that occurred on Sunday night at the Eagles live practice at the Link.
Right. It got a lot of attention because it was at the live practice.
It's one of those things where we see updates when people get injured at practice all the time, but when you do it at the stadium in front of a sold-out fan base, it's going to be talked about a lot more.
And last week's show was a little bit of like a fantasy football primer, whatnot, a mishmash of a bunch of different things. Today's going to be a little more focused on topics we've covered, but just interesting ones for relevant players right now.
Right.
And when we come back again, we're missing next week. We'll be back in 2 weeks, and then that's going to hopefully be the big primer.
Right.
All the preseason stuff.
Yeah, all the preseason stuff, all the people that got hurt over the preseason. All the people coming back from injuries, which we might
pre-draft.
The pre-draft stuff that you want to definitely get to before your fantasy football draft is coming out in a couple weeks with all the updated stuff. So definitely stay tuned to that. So, Sunday night happened. The alerts came out all over the phone, ESPN, different avenues, if you will. Landon Dickerson goes down, had to get helped off the field, had a knee injury. Big concern. Everyone's up in arms.
For those that don't live in Philadelphia or the Philadelphia area, what position does that guy play?
He's one of our offensive linemen. I believe he plays guard and center. He played center in college, I believe.
Plays guard now.
But he plays guard now. He played center a little bit in our playoff run last year when we had a little bit of a back and forth with some knee injuries. He also had a knee injury going into the Super Bowl as well. He had a left knee injury on Sunday.
Do we know what that was? Or no?
I couldn't find it. I tried to look it up because I knew he was playing with something with the knee injury, and Cam Jurgens was dealing with the back. So I think Cam Jurgens went down and Dickerson went in to play center for one game, and then I think Jurgens came in because that's when Dickerson hurt his knee, and at halftime Jurgens came in. I forget the exact timeline, but something along those lines happened in that playoff run last year.
Yet they won everything.
And they won, thank God. Our offensive line has been such a big part of our success across the board.
It's unbelievable.
And you think about Jason Kelsey and how good he was as center for so many years in Philadelphia. And then he goes away, and it's almost like they didn't skip a beat. They get Cam Jurgens.
The void. Amazing.
I think when they drafted Landon Dickerson as a center, they was like he was going to be the one to take over for Kelsey. But then Cam Jurgens came in, and he became the guy.
Right.
They moved Dickerson over the guard, and it's worked out pretty well.
Sure.
So you can't beat that, and it's a great thing for the Eagles to have such a good offensive line. But now he's got a knee injury. He's had a history of knee injuries. As mentioned, he had the left knee injury for the Super Bowl run last year. He tore both of his ACLs in college, right and left. And so he injured his right knee on Sunday, and this knee, he tore his ACL back in 2016. So about 9 years ago, he had the ACL surgery on that knee. And here we are again with something else.
That's always a tiny bit ominous.
Yeah.
Right? For especially for a football lineman. Right?
Exactly.
Like a big guy like that. The reports are like, he'll be back for the first game, right? Like, or hopefully we'll be back for the first game, but...
Yeah, and I think at first it was very more of a negative connotation to the reports. They're like, oh, he might be done for the year. He might be miss extended period of time. And then it's like, oh, he might need just a few weeks. He's going to have a minor procedure done. Right. And I think tonight, a little bit of our focus is trying to define for folks who may not understand what that minor procedure is. Because unfortunately, he's not the only one who has this minor arthroscopic knee procedure on his little ticker, if you will, that in the offseason. And it's just very basic information. It's not like they don't go into detail what they're done, what that could mean, but it's like, oh yeah, he just needs a couple weeks. He just had a quick scope, no big deal. Yeah. It's like, well, it's still a surgery. It's still like an invasive procedure of some sort.
And how come sometimes it's minor procedure seen in a few weeks, and sometimes it's done for the year?
Yeah, exactly.
And then it's probably appropriate time to say, we don't have access to his actual medical chart, his information.
Yep.
We're not speaking about his specific condition because we don't have access to it. We're just talking about these conditions in general. A little disclaimer, right?
Yeah.
And then the other guy that we were going to contrast him to
is J.J. McCarthy, right? Because last year he goes down with a knee injury, a meniscus injury. He gets surgery, and he's out for the whole entire year. And it's like, this is interesting because...
Isn't that the same injury?
You're telling me you got a meniscus injury that takes a whole year and a meniscus injury that takes a few weeks.
Yeah, dramatic difference.
Very much difference. And I think that's something that we can dive into and, just discuss of what the difference in between the full season meniscus and he'll be back in a couple weeks meniscus.
Yeah, and what may be one or two players may be like bouncing back and forth between those things.
Right.
Like, But so presumably... So I think the Eagles have been somewhat forthcoming that with Landon Dickerson, it is a meniscus injury that they're dealing with.
Yep.
And it's happened very fast. Like it always happens very fast for these guys.
Yeah.
We had the injury Sunday. There's information about it already on Monday. I don't know when his surgery's planned for, but my guess is it's
probably
if it hasn't happened already, it's going to happen really quickly.
Exactly.
So when it comes to the meniscus, there's for the most part, if you have I would say there's two surgical ways to treat it.
Right.
Like there are some non-operative ways to treat it. Usually young, athletic, it usually winds up being a surgery. A little bit older, complex tear. Someone starts getting a little bit of arthritis. Everything in the knee softens, and including the meniscus. And in that scenario, we usually try physical therapy, give a little bit of time. If you have an asymptomatic tear, who cares? Just leave it.
Right.
Leave it alone. Right.
Yep.
But in this scenario, professional athlete, young guy, very active. Typically winds up going down a surgical pathway. It really depends on the type of tear.
Right.
And I will say, and we can get into a little more details on each one and what differentiates them from each other. But I would say that there's three main surgeries that can be done. Right. The first surgery is partial meniscectomy.
Yep.
And we'll get into the whys and whats soon. But in short, partial meniscectomy is you trim the torn portion out, right? There's a tear, there's a little piece flopping around, trim that piece that's flopping around. Now you have a little less meniscus, but there's no tear and it's nice and stable.
Yep.
Option number two, there's a tear, put some stitches across it, sew it back together. A little bit of a longer recovery because you need to get that soft tissue to heal.
Right.
Then there's this third entity there's something called a root tear, which is a little, and actually, to be honest with you, there's even a few more entities on top of that. There's something like a ramp lesion or capsular revulsion. But for the most part, the big three are meniscus tear, trim it out, meniscus tear, repair it, root tear. And that's a whole nother ball game. So the root is where the meniscus is anchored down to bone. So when the thigh bone comes out and puts pressure on it, if the root isn't attached, the meniscus is just squirting out of the way. Oof. That's a real bad problem. Yeah. And so that's like the granddaddy, right? Like there, you got to basically reconstruct, repair the root, and in order to get that one to heal, that's definitely a full season type job, and on crutches, non-weight bearing, 6 weeks. That's a tall order for anybody. Yeah. That's a rough one. The only good news I would say is you don't frequently see that in a younger population. It's typically 40s, getting a little older, everything's a little bit softer.
Right.
Yeah. So theoretically, that none of the guys we're talking about are seeing that, but random stuff happens, especially in conjunction with an ACL.
Right.
Sometimes then you see that root tear.
Right. And I think that's something that, that questions exactly what happened with J.J. McCarthy, because now there's a little bit of both sides of this too. Like, yes, he could have had a potential root tear, which again we don't exactly know. But it's also, this guy just got drafted in the very first round for this team last year, and it's like this guy's their future. Yeah. He has a knee injury. Why run the risk of messing it around and give him a year to kind of rehab, get all these other things fixed up, and then learn the system, learn what's going on with the Vikings, and then get him back out there. Now he's out there, he's playing. Yeah. I believe he's set to be the starter. If I'm not mistaken.
That's why they jettisoned Sam Darnold.
Exactly.
Right? Like part of it is almost like team doesn't want controversy, right? They don't want the distraction. Yeah, get that other guy who was pretty good. He tanked at the end a little bit, but get that other guy out of here, and we'll go with our guy.
Exactly.
Yeah.
So I think that's something to, again, to compare to, right? And then it's also, I think there's also a big comparison in just the physical demand of the position, right?
Sure.
Landon Dickerson is driving a lot of force through his legs, moving
a lot of
other 300-plus pound people.
Right.
Especially if the day comes or in September when we play the Buccaneers and they have that 400-plus pound defensive lineman who's allegedly going to stop the tush push. So we'll see what happens when that big boy plays.
That's very interesting.
Yeah. He's the guy they're going to probably put right in the middle and see what happens with that. But
not a bad strategy, you got to say.
You got to move weight, you need weight. So So I think it's just a little different, right? Because the physical demand on the knees for Landon Dickerson is much higher.
I think that's factor number one.
Yeah.
For sure. And so getting a repair. So all right, to be clear, what's going on there with the repair, right? So you have torn tissue, right? One side separates from the other side. So you're putting stitches across that, and there's a few different ways we can go about putting the stitches across that. It used to be literally you pass these long needles with stitches across the tear site, and you'd have almost looks like a spoon, kind of in the back of the knee to catch that long needles to make sure you don't hit anything else, and it would deflect out an incision in the back of the knee. So it was a much more invasive surgery because you're doing bigger incisions to kind of catch the knee. Now we have a ton of very, very good all-inside implants. So you're passing these implants that pass through the tear. They have a little wall or a little stopper, and it passes through the tear and then through the capsule, and then that little stopper deploys on the other side of the capsule.
Okay.
And it's usually two different implants that are connected to each other with a cinchable suture. So it's like a little knot that you can pull in, and it makes it nice and tight. So once you have each anchor, which are connected to each other, deployed on the capsule, you cinch it down, and it pulls the two sides of the tear together.
Right.
So I will say it's made this procedure way more accessible, a lot less invasive. But the bottom line is those stitches are in the material or the meniscus. And if you start putting too much weight on it too soon, it's only a matter of time before those stitches will cheese great through, and you're back at square one.
Right.
So it is. You got to get it to heal. It's big, much bigger, longer recovery.
Yeah. I think just in general, like that surgery isn't as well known, or just like I feel like a lot of people in more of a general like layman's, they just say, oh,
meniscus, nothing.
Get trimmed a little bit and you'll be good.
Right.
Even when when I was getting our pre-show beer up at the bar tonight, the bartenders were talking about, they were like, oh, you guys talking about Landon Dickerson?
They know.
They're like, of course. And they were like, on WIP, they were talking about it all day today. And John Ritchie was talking about how, I had that surgery before on a Friday, and I was playing by Monday and all this stuff. And yes, it does have a quick turnaround if, the patient warrants it and there's a lot of all good things aligned.
Right.
But it's usually not always the case. It's not the quick turnaround. It's still a procedure.
It's still surgery.
Right.
Your knee swells.
Yeah.
There's something in your knee that's not supposed to be in your knee. It's pretty uncomfortable. Could you go back, right? Like if it's the Super Bowl, like is he going back, within a few days? Yeah, maybe
probably.
He is.
Yeah.
And there's probably fairly low risk with doing that. But in general, that's not the right way to do it.
Right.
Like you don't want to risk of popping those portals open. You don't want to run the risk of like aggravating the knee.
Right.
This part is a little bit nebulous, right? Like this is for the trim out, not for the repair portion.
Right.
But in reality, right, you have this tear in the meniscus. That tear actually, once the meniscus is torn, it's not functioning. The torn portion, at least, is no longer functioning as a meniscus. The cushioning portion of the equation has really stopped working. And so, if it's in there and not doing anything, you kind of leave it alone. If it's asymptomatic, not a problem.
Right.
But if it's symptomatic, your knee is swollen, it's causing pain, we worry the tear is getting bigger, it's causing more problems. You go and you trim the torn portion out, put an end to the issue, right? But you have less cushion in your knee now.
Right.
And the bone and the cartilage, right where that meniscus was, has to absorb a little more stress because the cushion isn't there to absorb that stress. So if you start slamming a bunch of extra stress onto the cartilage and bone, if you're 25, usually your bone's hard enough and strong enough that it can take it. But sometimes it's not quite there, and it will adjust if you ramp up your activity. Right, bone responds to stress.
Right.
If you go for a light jog, wait 3 days, go for another jog, wait for 3 days, go for another jog. You're stressing the bone. It's receiving that impact.
Yeah.
And it will respond. It will begin to rebuild in those in between times. But if you go for a 6 mile jog, day 1, day 2, day 3, day 4. You wind up with a stress fracture, or at the very least, bone contusion, and it's very painful. Your knee swells, and it just slows down the recovery. So sometimes you can push it, sometimes you get away with it, and if the end justifies the means, right? Like if it's the Super Bowl, maybe it's worth the risk. But if it's if it's preseason, no, go slow, take your time. Don't take any additional risk.
And even if you have to, if in this world of invest a couple extra games, say like, again, I hope he plays week 1, right?
Yeah.
Like, sure. But if you have to invest an extra week or two in the beginning of the season, you're going to want your all-pro guard to be in for the long term, not, the quick turnaround. Because, yes, I get it. Week 1 against the Cowboys is a big deal.
It's a big game,
But it's not the end of the season. It's not like... You can move on if we lost that game.
If there's a worst case scenario,
right?
A lot of season to salvage.
Exactly.
Yeah.
But I think with that too is like you mentioned, like the, over time, or what are your thoughts, right? Like this, I feel like the meniscectomy is generally viewed as a quick return, faster recovery. But would you argue to say that, however, there might be some long-term effects of,
heck yeah,
of trimming that thing, and then we could go down the avenue of the Joel Embiid needs.
That's exactly where I was going to
of like continuous meniscus surgeries and meniscus surgeries and meniscus surgeries.
Yeah.
How much more meniscus? Again, this is not what we're talking about, but in this example, how much more meniscus is left in Joel Embiid's knee?
Probably not.
Right, and then you have someone like Landon Dickerson who has a history of an ACL surgery. Back with or without meniscus involved. We don't know.
We don't know. We don't know if
like
they did
this
any
could
work.
be. He could have already had this trimmed once, and we don't know it.
Or repaired once.
Exactly. So that's something a little devil in details with that of like what could be the long-term effects of this, because he's only 26 years old. He's probably got a good, hopefully like another 4 or 5 years left in the league if he plays, so about 30 if we're lucky.
Hopefully more.
Yeah.
I mean, maybe not. The lifespan of a lineman may not be that long.
I mean, I think the average is about 3 to 5 years in the NFL. If that, I think the 5 years is giving him a little extra. But, with these compounding knee injuries and stuff, it's like you never want to see someone's career just go downward.
Sacrificed over the, making sure they made it back at week 1 instead of week 3.
Exactly.
Yeah. No, for sure. And then you do worry. You do absolutely worry about too many surgeries on the same knee. And I feel like a lot of people think or feel like, oh, meniscus, no big deal. It's nuanced, man. Sometimes it's not a big deal. Sometimes it's a little bit of a bigger deal. Where the tear is in the meniscus relative to how central it is, kind of in the middle, versus how peripheral it is, close to the capsule, close to the edge of the knee, is a huge determining factor, right? And then the tear pattern, does it go straight across the meniscus? Is it a vertical, straight up and down tear? Is there a little flap that's... All of these things really determine and factor in. So, like, one meniscus tear is not another meniscus tear, is not another meniscus tear. And I think a lot of people get caught up. Like, hey, I know this guy, and it was nothing. But why was it such a big deal for that guy? And they may have had a different tear, may have been in a different place. It might have gone a different length across the meniscus. And then the plus and the minus, right? This is big difference probably between McCarthy and Dickerson, is that if the tear is more on the periphery, closer to the capsule, the blood supply is much better. So one, those heal better. So you're more inclined to repair those because they heal better. But two, you're more inclined to, sorry, not heal those, you're more inclined to repair those because they heal better. But then two, you're also more inclined to repair those because in order to trim the meniscus back to that tear that's on the periphery, you have to take out a much bigger piece of the meniscus, and that's not good. Like that.
Not at all.
That's exactly what you're trying not to do. You're trying to save as much meniscus as you can because that gives that person the best chance of not having problems in the future. So that's a huge determining factor. And I have this conversation with patients sometimes in the office. Like I look at their MRI and they're like, "Oh, meniscus, not a big deal." Yours goes pretty far to the periphery. I hate these tears because of this. Like this is what it could potentially mean. And I'll actually sometimes push the limits on what we would normally repair. Kind of biologically, the guidelines are like 30, 35 years old. At that point, don't really repair them anymore unless it's a root. But I will push those limits because I hate going to the periphery. I feel like the outcomes are clearly not as good once you start going really, really close to the periphery.
Because I think even with that too is I think the general idea of like, oh, you just take it out, no big deal, it has no use. There's a pretty big function of that meniscus in your knee. It's very much for shock absorption amongst other things. But like, it's very much needed. It's not just, I think
there's a stability factor there.
Exactly. Sure. And then with that history and change of cartilage and all that stuff and long-term effects, you never want to have a compounding knee issue and have these reoccurring knee issues that always keep happening to the meniscus, like the Joel Embiid, example. Like,
or even I forgot his name. The gentleman who sued the doctors.
Maragos.
Right. Like that's a scenario where he, by all reports, he was on the other side of it. His knee was already arthritic, and at that point, the meniscus isn't really a huge factor. Your knee is already arthritic, which is why I feel like that. Again, I don't know all of the details, but based on that, I feel like the docs who were taking care of him got hosed a little bit. Like that wasn't really a fair assessment. Once you're arthritic, the meniscus, it has less of a function. The whole point, not the whole point of the meniscus, is to try to prevent you from going down that way. But one of the things that it really does, it prevents arthritis, and that's why we work so hard to preserve it. Once you're arthritic, it's a little less important.
Yeah, you're not going to do too much. Once that joints are arthritic, and we've talked about cartilage replacement and other things like that. And that surgery and that outcome is much worse than a meniscus repair.
Tenuous, right? For sure. And a lot of cool stuff on that horizon. We'll circle back and talk about more of that stuff as we go along. It makes you understand, or makes you sort of accept why McCarthy misses a whole season. And again, we don't know the details. Presumably it was a repair. I guess theoretically it could have been a root repair. And that one's big. If it was like a root tear, what happens when you have a root tear, if you don't address it, is typically people get arthritic 2 to 3 years. Like not like a little bit arthritic, like, oh man, you're heading towards bone on bone. And a young person, like, we don't have any options. That's a hole in the world of orthopedics.
That's like if that's the case, then you run that risk, then you're not drafting that guy first overall just to burn him out in 2 years and end his career. You want that guy for the long term. Fix it, make it most stable, make it the least chance of arthritis or long-term problems.
That guy's getting a meniscal transplant, which means we're trying to get you to walk again. You're not playing football.
Exactly, right. Outside of the likes of, who was it, Alonzo Ball and the other guy.
Going for it. Was it Landon Scott?
hopefully this isn't the case for Landon Dickerson. It's a quick turnaround.
Yeah.
It does well.
Yeah.
His youth and his strength is on his side, I hope.
And it's interesting that you say that, like youth and strength without question, right?
Mm-hmm.
I don't know why I have this connotation in my head, and I shouldn't, because all these guys are very young.
Right.
But as soon as you hear football player knee injury, in my mind, it's like you go to bigger, older guy, and they're not at all, right? Like otherwise they're not in the NFL. Right. But that's like the connotation is it's not a college player.
Right.
Maybe he's only a year removed from college, but in my mind, it's like he's so much older.
And it's also, again, we don't have all his medical information for this, but we do have some of his medical history, and this is like not his first rodeo getting arthroscopic knee surgery. Like he's already had his ACL done. With or without meniscus involvement, we don't know.
Yeah.
Hopefully, it was just purely an ACL, and there was no meniscus problem.
I hope, yeah.
And that they're nice and healthy. This is the first time they've ever gotten injured playing football, being 300-plus pounds, playing it.
Hopefully one ligament, not a multi-ligament injury.
Right, exactly. So hopefully, outcome's good. We have about 3.5-ish weeks, less than 3.5 weeks until the season opener.
If it is just a pure partial meniscectomy, which is what we've been led to believe, my gut is he's there for the opener.
Yeah.
What are your thoughts?
I think he'll be ready, but I don't know. I feel like we might not see him right away. I think they'll give it time. Because at the end of the day,
the safe bet.
You safer bet, and you at least get one sample size of a whole game of his backup.
Right.
And then you store that data in that film. Like, all right, we got that guy on the backup.
Right.
Let's see what we got the rest of the way once he's 100%. And but I get it. Eagles don't like to lose to the Cowboys at any chance.
That's one of the reasons why I feel like get out there.
Yeah, and that's like something that might drive the factor of him getting him back sooner than later. For that reason alone. So I think it's something to see, and we'll keep an eye on it. But
of course.
Again, we've talked about how this is a general minor procedure. So this is going to jump me into our next topic.
Before you go there, speaking of minor procedures, I guess it's not a minor procedure. Minor eye injury or superficial eye injury.
Yes.
Still,
Najee Harris,
cleared to walk on the track or something.
Run around the track a little bit.
What is happening there?
That whole story, once that more details come out, we got to talk about it. We might have to get some eye specialists on here to discuss a little bit.
I don't get it.
But,
But all right, I'm sorry.
No. But Najee Harris is on the Chargers. Yeah. And this player was a former Charger and has had some very unfortunate injury history here. Tyrod Taylor has been a quarterback he's a veteran in the NFL. He was a starting quarterback for the Chargers, and then unfortunately was on the wrong end of a needle and punctured his lung for a pain stopping injection.
Yeah,
and punctured the lung, and he was out for the year. And then so sprung Justin Herbert's career as a rookie. Right, and the rest is history.
Who's going to take over at some point?
Yeah. Exactly. And Tyrod Taylor kind of is that guy for a lot. Like, I don't know exactly if he was exactly in line, but he was with the Bills, and he was their guy for a while.
Yeah.
Incept Josh Allen has taken over. I think he was reigning season MVP.
Right.
Goes to the Chargers, same idea.
Yeah.
Now he's on the Jets, and he's reported to have a minor arthroscopic knee procedure. He's backing up Justin Fields now in New York.
Right.
And they just said he's out for the season. Out for the preseason. Hopefully he's ready for the season opener per the report.
Right.
So, reading that with a bit of education behind my background, I just say, it's probably a little meniscus cleanup, no big deal. Same thing like Landon Dickerson.
Right.
But I think it raises an eyebrow of like, why aren't they just saying it's just a meniscus? Or what is this minor procedure really entailing? What are they doing?
Yeah.
So I think again, we don't have the access to what they actually did, but it's just one of those things where it's
speculation.
Exactly.
I still have a number of patients, especially in that like 40, 50, maybe approaching 60 range, probably more that 50 approaching 60 range, that will come in and say, hey, my doc told me I need a clean out. Like just go in and just kind of clean it up in there. I have to imagine that the docs that are taking care of the Jets are full aware. And like, I feel like it's a crushing sort of news blast when I say, hey, listen, if there's something for us to do, adjust your torn meniscus, whatever it is, then there's benefit. But the idea of the clean out, the washout, just clean it up, doesn't necessarily work. But when you hear someone getting a minor procedure, again, he's been a little bit snake bitten, not his fault. I hope that's not what's on the table here. I would like to think it's probably meniscus.
Yeah.
And he's not, older guy. He's still pretty young. Mm-hmm. But football players, the generation that needs is accelerating. Yeah. The other thing I thought about there, in that vein, right? The generation that needs accelerated. Maybe it's not meniscus. There could be like a loose body or something floating around the knee, and that is a minor procedure. They go in, you pluck it out. It's like a pebble in your shoe, or I don't know, sand in the gears. Maybe that's a better way to describe it. Sand in the gears, and you go and you pluck out the loose body, so you don't have that sand. And it's important to get that stuff out of there because that stuff beats up the joint.
Oh, right.
So, and you bounce back like it's nothing. You bounce back. I don't want to say like it's nothing, but relatively quickly. Right. I think the most likely scenario, torn meniscus, minor procedure. They're kind of grouping it with all the other smaller, quicker ones. But it is interesting.
So he's 36 years old, Tyrod Taylor.
Wow, he's that old?
Right. And it's something that, until I just saw the number myself, I was like, no, I thought he was maybe like 30.
That would have been my guess.
If I had to guess, I would have said like 30, but he's been around for a while, which is kind of interesting to think about, right? Like he's been all over the place.
Right.
Backed up a lot of people, started a lot of different places.
He's a good quarterback who always seems to be on a team with a better quarterback.
And that's 100% true. And I think that always happens to him, and he always has some kind of injury that just segues the next guy, and he's not going to get his job back, unfortunately.
Yeah, and then Tom Brady steps in and just eliminates him. Right. Oh, God. And actually, I guess of all of his situations, like Justin Fields is probably the guy that he stands a chance at displacing.
Yeah, because, Justin Fields, I think, will do okay for New York with the Jets, but there might be something that happens, and, with more mobile quarterbacks take a lot more hits. So, you
never know.
You never know what's going to happen with that.
I do feel like Justin Fields got a little bit of a raw deal in Pittsburgh last year.
Yeah.
Right? He's in Chicago. They were growing pains. The team was never great. He gets to Pittsburgh. The team is not great, but he was doing pretty well with them overall. Yeah. I think there was a commitment made by Tomlin to Russell Wilson. And Russell Wilson came off on fire those first couple games. And then Justin Fields never got another chance. But he really did perform well.
He was like 4-2, right, as a starter?
I don't remember if it's 4-2 or 5-1, maybe even.
Yeah.
And it wasn't like glorious numbers, right? Like it was making a play when he needed to make a play, making a play with his legs when he needed to make a play with his legs, but winning games. You know what I mean?
Yep, exactly.
And so theoretically, the Jets are gonna. They have a good team. I don't know why they can't win, but seriously,
no, you're not wrong. I mean, they have. I don't know. I think Sauce Gardner and what's the receiver's name?
Wilson,
yeah.
Garrett Wilson. Right?
Both are like the highest paid in their position now after this offseason. They're paying the right guys, at least the playmakers, if you will.
Right.
And they still can't find a way to get on the win column.
They had what's his name? The running back. I haven't even started
Breece Hall.
Breece, and like he gets displaced. A lot of talent on that team. The defense was going into days was supposed to be the best defense in the league. And so you would think a lot of room for success. And maybe the problem was Aaron Rodgers, right?
Yeah,
maybe that was the issue.
Could have been just too many distractions with the whole deal.
But insert Justin Fields. Maybe this is finally where he succeeds.
Maybe
honestly,
Maybe going for the young quarterback with more potential than an old quarterback who maybe still has a few more left in him might be the better recipe for their options.
Now that said, I could also see Justin Fields falling flat on his face and Tyrod Taylor getting a chance. I could see both options.
They call him like a system quarterback. He can manage the game and he won't lose you many, but he'll keep you interested. And
that's his role. That's what he does.
You hope the defense kind of gets some turnovers, helps you out a little bit, and you can win some games that way and figure it out.
I wonder how much, and it was a very good point that you just made, based on his age. Like I wonder how much let's say this is a meniscus tear, and he realizes this is my last shot. Just I don't care what the consequences. Just cut out the tear and let me try to get back and play.
Right, because
even if it's a repairable tear.
Right, you're talking about a guy who's 10 years older than Landon Dickerson, right? Yeah. So definitely the span of time is way different in what they're doing.
Heal ability.
And exactly, and I think, like you said, Tyrod Taylor is on the tail end of he's in the fourth quarter of his career by far,
for sure,
without a doubt. Yeah. Right, so why push the envelope? It's like no, clean this up. Yeah, I might deal with this in a couple years, but I'm sure everything else that he's had in his NFL career will also come back and hurt him a little bit in the future.
Right.
So why not go for the quicker fix, clean it up, take the meniscus out, trim it, and then just go back out there and start playing again.
There were a couple other guys that we'd written down here. Rondell Moore.
So, a little bit about Rondell Moore. This is kind of hot off the press here. It is Tuesday, and this will be coming out on Friday. But Rondell Moore went down with another season-ending injury on his knee. That is the second year in a row he's had season-ending knee injuries. So, for my brief timeline here, he's with the Cardinals. His rookie season, I believe, did okay, had some splashes of success.
Right.
Goes to the Falcons. I think he got a decent deal with the Falcons. Got injured before the season even kind of started, was out for the year. Now he goes to the Minnesota Vikings, who we've talked about with J.J. McCarthy.
Yeah.
And what a place to be when you have, like we mentioned last week, with Justin Jefferson with some hamstring injuries. Jordan Addison suspended for some drug stuff or whatever, the performance-enhancing drugs. And so you have all this upside of this guy who's played in the NFL.
On a very good team.
Right. You have an opportunity, and then you go down again. And some guys, it's unfortunate, but their careers are just ended so quick.
Yeah.
And they never get to shine. And they never get to shine because they get injured too much, or they just get the wrong side of the stick, and then bad trade, bad change in management, whatever.
Do we know what the injury was?
We don't. So it happened on Saturday or Sunday in their preseason game, and I think it was one of the very early snaps of the game. So this guy really didn't get any time.
Yeah.
To show off anything.
And they've already announced done for the year.
Done for the year, and I think they're getting MRI today. And so now we're kind of waiting a little bit on what that MRI results come back. But so I think it's one of those things we'll track a little bit to see what it is and just kind of see now what we don't know, and I didn't really go into grand detail with it, is the same knee that he just hurt.
Yeah,
God forbid did he
question.
re-tear something? Did he get re-injury? Or is he part of the statistics to say he tore the other side or did something to the other side?
That's a really good point.
And that's also a high risk of someone who's coming off of injury or whatever the case is.
So one of the most mind-blowing statistics that I ever heard.
Yeah,
right? The fact that you're at such a higher risk for your other knee.
Right.
Yeah.
No, that's your good. No, that's just also at risk.
You're predisposed.
Yeah.
That's really what it comes down to. Right?
Right.
No, unfortunately, you're predisposed. If you tore one, you're predisposed, and you have a higher risk of tearing the other.
Right.
That's rough. Now, another thought that I had, there's of course there are more than one injury that could keep you out for the season. The first thing you think is ACL, especially someone who was previously torn their ACL. Mm-hmm. Another one where you kind of know right off the bat is extensor mechanism, right? Mm-hmm. So if it's quad tendon or his patella tendon goes, the sort of standard axiom there is that people over the age of 40, and this is how I remember it, when board fodder. I pretend your patella is 40 years old, right? So if you're over 40, you tear your quad tendon, and if you're under 40, you tear your patella tendon.
There it is.
Yeah. So that's how I remember it. So presumably that would be on the table for him. That would end the season. And of course, there are a few other injuries that could have done that to end the season at this point in the year. But I think the big two are ACL, and then the second would be extensor mechanism.
To go back with that, what we're saying, right? We're kind of waiting for this MRI to come out with a report for Rondell Moore. But I think there's also been two cases this preseason so far that have been really, the news has changed after the MRI reports come out.
Yeah.
So we've mentioned Dallas already, so we'll talk with them first. So the Cowboys have a left tackle named Tyler Guyton, who was injured on the 28th of July, and it was reported initially that they're concerned of possible ACL injury.
Sure.
And then it was just kind of fun. Again, I think I get a bit of entertainment out of news article headlines and kind of how they catch the general public when it's a trained eye looks at it and wait a minute, what?
Yeah.
And so it says good news, no surgery needed for Guyton, no ACL tear.
Yeah.
And it says MRI revealed ACL's intact. He only has a fracture, out 4 to 6 weeks, no surgery. So it's well, yeah, I guess that's good news, but that's still pretty significant. It's not. Every day you just want to fracture something in your knee or in your knee area, and you want to just go ahead and go with it.
Isn't that amazing? No big deal. He only broke his bone.
Only broke a bone. No big deal, right? And I think that kind of aligns with...
But there's truth to that.
But I was going to say, is I think the general public has an idea of you're better off breaking your ankle than you are spraining it for long-term health and stuff.
I don't always believe in that.
And I don't agree with that either. But it's interesting in that how that was feared ACL, and then, MRI report says ACL attack, all good. Just a little fracture. He'll be back in about 6 weeks.
So really, the devil's in the details there. Yeah. What did he fracture, right?
Exactly.
So the ACL attaches to tibial spine, a little the bone on the top of the shin bone, and sometimes it pulls that piece of bone off. And it's almost the equivalent of an ACL tear. The good news is you can honestly, if it's an older, lower level athletic activity level patient, sometimes you leave it alone. Their knee remains a little bit loose, but functionally they tend to do okay.
Right.
And if they're younger and higher level of athlete, there are a bunch of really good ways, easy ways to fix that.
Yeah.
We always worry that the ACL stretch at the same time it pulled off that piece of bone. So sometimes you fix it, seems like they're doing okay. You think they're going to do okay, and then they're not, and you come back and do the ACL later.
And I think, with the fracture piece of it too, is like, yes, that's good news in regards to like but the best news if you want to come out of that situation with anything would just be like some bony contusions, bony bruising, which is again, subtle
crack.
Yeah,
right? Only saw it on the MRI, kind of subtle crack. Right. Yeah.
And
that is 6 weeks.
Yeah, that's even still exactly. And I think that's a better news report for than still with the fracture. That's still a significant amount of time.
But then next thing, like if it's the end of the thigh bone, the medial or lateral femoral condyle, something like that. There's a whole bit, or like a tibial plateau fracture.
Right.
And the truth is, yes, they heal a little more predictably as long as it's not displaced and whatnot. And you do come back way more quickly because bone does tend to heal better, faster than soft tissue. But even that, like 6 weeks, might be a little bit optimistic.
Yeah, and I think it's also interesting too. It just kind of shows you with these like various reports of like, possible ACL, MRI reveals something. It's just how the knee presents on a clinical exam too. Like,
true.
I remember my first tibial plateau, like clinically, it was during a soccer game, and I was doing like my mental differential. I was like, there's a chance there's a tibial plateau fracture here, like based off pain presentation and everything. And I was like, but like doing ACL tests, like I don't feel confident in that either. But then lo and behold, you get some imaging. It's just, and again, I just said it myself, just a tibial plateau fracture. Like that's still significant, but in comparison, yes, it's a little less likely.
And during my fellowship, I remember my fellowship director, and I hold true to it sometimes, but I remember him saying, like when you do the exam, if the guy gets hurt on the field, you do the exam. He's like, even if you think you know what it is, and lots of times we know, but we don't always, right? Like sometimes it's a tough exam. Even if you think you know what it is, just wait. Don't reveal it. Don't say it. And I feel like this maybe was one of those situations where, doc examined him, kind of suspected it's going to be his ACL, but some people, like, their knee's just looser than the next guy. And had that guy looked at the other knee, maybe it would have had similar laxity. You know what I mean? And so it feels like maybe it's torn, and you check the other knee, like, no, this is just normal for him.
Yeah.
And so sometimes that information comes out a little before it should have.
Exactly.
So I wonder if this was one of those particular situations.
And, and I think that's also something that, again, like you said, you said fellowship or residency?
My fellowship, yeah.
Like when you're in your training, like I see it a lot too with our students, is like they get their first positive Lockmans and their eyes light up. Like, no, you got to poker face.
All right.
Poker face. Don't let the patient know, it's not so good of an outcome.
And we don't have MRI vision. We don't really truly know. You have a suspicion. But
exactly. And I think it's a perfect segue into our next topic. Again, former Eagle C.J. Gardner-Johnson last week, got injured at practice, I believe. All the reports were like ACL tear, done for the year, big fear ACL tear, all this stuff. And then just tonight when we were setting up, I was messing on my laptop a little bit. I saw an article, C.J. Johnson Gardner's playing again this year. I'm like, wait a minute, what? He just tore his ACL not too long ago. And then now the head coach, D'Amico Ryans, is reporting that we're going to have him back on the field this year. We kind of dodged the bullet a little bit.
Right. What happened there?
Yeah. And that's like, and I went down every avenue of news source information to find some more info on C.J. Gardner-Johnson's knee.
Yeah.
Not much.
Yeah.
Other than there's a chance he comes back this year now.
Yeah.
Versus ACL tear done for the year.
Did he have a history of an ACL tear at some point?
I'm not entirely sure. He has a history of getting traded from the Eagles and getting injured, but not so much. I couldn't find a direct ACL or knee history there.
Right.
But again, one of those things where
that's the exact scenario you're trying to avoid.
Right. And, think about it, too. Like, that news outlet got released via, fantasy football apps, ESPN, Yahoo Sports, whatever, that he was done, tore the ACL. And, again, we get a little bit more info because he's a former Philly Eagle, and so people care about him a little bit. So It's like, oh man, he's done. Then it's like, oh wait a minute, now he's not done.
Yeah.
So what exactly happened? It sounds like he doesn't even need surgery per se.
Right.
So again, devil's in the details. We don't exactly know. It doesn't seem like the Texans are really revealing too much.
I wonder if it was one of the very classic partial tear, which then you're optimistic. Maybe we can get back because you do get back a little more quickly.
Yeah.
But in reality, most of those partials wind up being they wind up being functionally torn, and in the end. And we had Dr. Bernardini on, I remember, and he was like, all of them. And I don't think that's true.
Yeah.
But more than you would like.
Right.
Wind up, like when the rubber meets the road, when they try to get back to their full level of activity, they continue to have problems. And then in the end, they wind up getting the surgery anyway.
And I think also, from a functionality standpoint, I can go both ways with this. As a defensive back, your job is to react, right? And your job is to react, cut side to side. So having the inability to do that is definitely going to change your effectiveness on the field.
Yeah.
And CJ is very good at intercepting the football.
Right.
And he's been tied up there with the top 3, top 5 every year in interceptions per league. Yeah. So I think that'll change his playability. But then with that same breath of why I think, he could potentially cope a little bit ACL deficient is that his primary steps are always backwards first.
True.
And so, in theory, you would assume that his hamstrings are very, very strong.
Right. Well said.
And so when I was a student at Rowan way back in the day, we had a defensive back had a torn ACL, and he played on it.
Yeah.
And it was part of because his hamstrings were so strong, the dynamic
one of the rare copers.
Right.
Yeah.
The rare copers. And he could get away with it. Now, I don't think that's something you can get away with as well in the NFL.
Yeah.
And I think that's something that could essentially harm his value for the Texans.
Yeah.
And I think ironically, I don't know, I guess they're just going with the Eagles vets, if you will. They signed Jalen Mills, I believe his name, the Green Goblin. They just signed him to kind of back up if CJ misses some time, so they brought him in as well.
Yeah.
But it's one of those things where I'm going to be looking now that, again, I just found this article about 15 minutes before we started recording. I'm like, wait, this does not make sense to me of how the information got so skewed over a few days of it was torn, he's done for the year, whatever. I wrote it off sucks to that guy.
Yeah.
See you next year kind of deal. And now he's like, oh, no, he's playing this year at some point in time. Oh, this is going to be interesting. So seeing when he comes back.
He's not young.
I think, well, no, we looked him up. He's 27.
He's younger than I thought.
Right.
Yeah.
And again, I would have ventured to say that him and Tyrod Taylor, before we looked it up, were probably about the same age.
Honestly, I would have made the same guess. We would have been off by about 9 years.
Exactly.
Crazy.
So I think it's one of those things that we just kind of watch, see what happens.
Yeah.
But I think
hope for his sake that
I think
it was a little bit overcalled and he's going to be all right.
And I think it just gives the general public at least a little bit of a insight on how complex these knee injuries are. They're not so cut and dry. It's meniscus, ACL, MCL.
Right.
It's it can be a complex joint at times.
Absolutely.
It could present like A, and then you get an MRI and it's B. It's well, there's that.
There's patella instability. There are extension mechanism injuries. There's posterolateral corners, other ligaments, MCL. Mm-hmm. So it can be, and then even just the meniscus. There's, meniscus tear are 3 very different beasts depending on the type of tear, and
to go on top of the type of tear, the location, medial versus lateral, and all these different intricate details. It's yes, and I honestly don't even think they released which meniscus it was for Landon Dickerson or anybody we've talked about.
I hope it's not lateral. It tends to be a little worse.
And I think that's, you say that, and that's what's always in the reports for Joel Embiid's knees. The lateral meniscus is always the thing that goes, that's not a good look.
I know.
No, we don't want to see that. So I think it's one of those things that we watch.
Yeah.
Landon Dickerson has a tertiary fantasy football impact, right? Because he will affect the running game and, the tush-push success and Jalen Hurts success.
Saquon, the receivers.
Everything. The offensive line has
downstream.
It kind of will ripple out. Yeah. J.J. McCarthy's injury, as it goes on, will have, or his comeback, if you will have definitely fantasy implications. The other guys we kind of mentioned.
Other than the fact that, theoretically now for McCarthy, other than the fact that there's a little bit of rust from missing a year.
Right.
theoretically should be good to go.
Exactly.
Right? Yeah,
Took a whole year with that. Should be good to go. Should be primed. And
the bigger issues there are his receivers.
Yeah, as long as they can stay, healthy and stay on the field and stay out of trouble is the biggest thing too. And to go in the stay out of trouble part, with C.J. Gardner-Johnson's backup, the safety, I forget his name, but he's also just got arrested for some legal issues. So that's why they brought in Jalen Mills, if I'm not mistaken. So as long as your backups are available, then they should be okay. But we'll see kind of how all this folds out.
Factors to consider when you're drafting.
Yeah, big considerations, if you will, if you're drafting. And I think this is all going to be great when we do our next episode in a couple weeks, when we have all these lines up for all these big names for who's coming back. Yeah. We touched a little bit on the J.J. McCarthy because he might be one we omit now that we went through it a little bit.
Yeah.
But we'll have a little bit more of sample size of his preseason games, a little bit to kind of analyze it too as well.
Yeah.
So I think we see what happens.
For sure. All right.
Anything else?
Good stuff.
We went all over.
It was also nice to kind of talk about it, a little bit of injuries again, as opposed to just bouncing all over the place. I love talking about the subtleties, the differences, focusing on a particular injury.
The meniscus injury is it's kind of commonplace, and I think it's more complex than people say, it's whatever, just trim it.
I think for sure.
I think we touched on all that stuff tonight, and I think it was really beneficial there. So before we go ahead and close out our tab tonight, folks, we want to give a quick shout out to our sponsors, Virtual Orthopedics and Spine. They have you covered from runner's knee to dog walker's hip. They have a doc for that. Yard work back and laptop wrist, they have a doc for that too. Virtual Orthopedics and Spine has over 120 providers, over 20 PT rehab facilities, and more than 25 surgical centers all across South Jersey. So find the right specialist for you at virtual.org/ortho. Neck of the Woods Brewing Company, serving us up the best beer in South Jersey, the best sours ever. And then lastly, Timber Rail Productions, giving us all the help that we need to get this all this podcast out to all our awesome listeners. So we'll see you next time, folks.
Packaging it up beautifully, you know what I mean?
Exactly, every time.
Yeah. Quick personal message too. Miss you, Frank.
Yeah, all right. Miss you, Frank. Thank you, Kyle. Thank you, everyone who helps us out. And we'll see you guys next time. And be ready for that big fantasy football draft preview. Talk to you next time, Gov.